Members, please know the Chair will have the answer and the question. North Coast.
Honourable Speaker, there is a healthcare crisis in rural BC, and it involves not just unacceptable wait times for surgical treatments. The depth of the crisis is so severe that they're actually closing down emergency rooms in hospitals. Just this weekend in Oliver, the ER at South Okanagan Hospital was closed both Saturday night and Sunday night due to the doctor shortage. What is the Minister of Health going to do to fix the ER closure for the people of Oliver?
Minister of Health.
Thank you, Honourable Speaker. Honourable Speaker, this is always rich coming from the NDP. That in the 90s, Honourable Speaker, decided the way to manage healthcare was to restrict the number of doctors practicing.
Excuse me. Members. Surrey Wally, we're proceeding when everyone's quiet. Please continue.
Honourable Speaker, we have over double the number of physician training opportunities in the province of British Columbia. We have a multiple of 10 times the number of IMG, International Medical Graduate Resident spaces in the province of British Columbia. We have practice-ready assessments for physicians that have been practicing in other countries to welcome them into British Columbia. If the NDP government in the 90s, Honourable Speaker, had done that, we'd have 1,000 more doctors in the province of British Columbia today.
North Coast on a supplemental.
Thank you, Honourable Speaker. In January, the people of Oliver were warned that there'd be no doctor available to assess them at their local emergency room after midnight. And then this weekend, their ER was actually closed for 2 nights running. Madam Speaker, in Boundary Similkameen, it's getting harder to go to school and it's dangerous to get sick. We've seen this government's lack of response to the education crises in Osoyoos. What is the Health Minister going to do to fix the ER problem in Oliver? We'd like to forget.
Minister of Health.
Thank you, Honourable Speaker. Thank you, Honourable Speaker. I know the hospital in Oliver is an amazing hospital. I've been there and visited with them, and they do amazing work. But the challenge for many rural areas, not just in British Columbia, all over North America, is the attraction of physicians and other health professionals. So we have a suite of programs available in the province of British Columbia, Honourable Speaker, and we have seen communities like Clearwater, like Princeton, like Quesnel, where we have 8 more physicians this year than we did last year. Honourable Speaker, we have more physicians per 100,000 people in the province of British Columbia than we ever have. However, the population is changing, the profession is changing, and it is a challenge to meet all of the demands of that population. But we're working very hard, Honourable Speaker, and when we have issues like we do in Oliver, we work hard to solve them, and we'll continue to solve those problems.